Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great exercise for those of you with low back spondylolisthesis pain who are using plank exercises to develop your abdominals. I'm going to be sharing with you one of the best kept secrets or unknown training techniques to help really accentuate your abdominal training with planks and help to relieve spondylolisthesis low back pain. Hope you enjoy. So if you've been watching our channel for any length of time, you know that when it comes to spondylolisthesis, most cases of spondylolisthesis are aggravated with extension, meaning that the curve in the lower back, the lordosis, increases, either from having the tailbone come up with an anterior pelvic tilt or having our upper back lean backwards. That can happen when we're walking downhill very easily. That increases the lordosis, wearing high-heeled shoes, or muscle imbalances and posture problems where the pelvis is rocked into an anterior pelvic tilt, or we have poor mechanics in terms of being able to control extension. So one of the things that's so common throughout spondylolisthesis rehab is developing the abdominal muscles. The abdominal muscles, when they're developed, help to lock the rib cage down and the pubic bone up or tail under. It helps to prevent that excessive extension. When you have weak abs, the tailbone can come up and the upper body can lean back. When you have strong abs and they're engaged and you're using them, it helps to lock that so that arch can't increase. So one of the most important exercises that's given for this is an isometric exercise, meaning we're tensing without moving, known as the plank. So the plank is done on the floor where you simply hold the top of a push-up position. And in this position where your body is straight, you are resisting gravity's ability to sink your low back down, because in gravitational forces in this position, your mid-body wants to sink and that wants to arch the back. So just holding a straight plank many times is going to be a great exercise to increase the abdominal strength and hold you in a neutral position so you don't increase that arch. But straight planks don't really overemphasize the abdominals. There's a lot of muscles working there, including the abdominals, but it doesn't really dominate their force production. It doesn't make them work as hard as they can. So thus, when you do that, there's still a possibility that that arch may be a little too much and you could have pain with planking, as some rehab patients do. The other problem is that if you're not increasing the real contraction of the abdominals, you're not getting the most out of your exercise. You're not getting the biggest bang for your buck while you exercise. So the tip that I'm going to share today is one that I use with all my patients in the office as well as online clients. When we're training abdominals, I teach them to emphasize the tail under, meaning that they're going to rock the pelvis a little bit more in that plank position. They're going to tuck the tail under and tilt the pubic bone up towards the chest and crunch the ribs as if you're doing an abdominal crunch downwards. And that extra motion highlights the abs. So if we go back to this exercise, I'll show it just a little higher so you can get a better view. In my plank exercise, I'm going to bend my knees slightly, tuck my tail under, and crunch down. And that extra little bit you'll immediately notice is going to really highlight the abdominals. When you hold a straight push-up position, the abdominals are working. But when you bend the knees slightly, tuck the tail under, and crunch, you'll notice, wow, my abdominals are really firing. And I can use that for a straight plank on the floor by tucking tail under and crunching. I could use it for a modified inline plank where I have my hands and legs stacked on top of each other, which creates more rotation in my body, same position. Or I could use it on a plank where I'm using a opposite arm and leg lift holding my plank, which is a more advanced plank. Any of these varieties of planking, I'm emphasizing that tail under and crunch down, and it really helps to emphasize that abdominal contraction. You'll notice that you won't be able to hold your planks as long when you first begin, but over time you're going to notice your abs are working a lot harder, and that helps to improve your ability to hold that position of tail under and crunch down, meaning a slightly decreased arch when you're working, when you're walking, when you're working out. So it helps to prevent that extension pain that oftentimes aggravates low back spondylolisthesis conditions. If you'd like to learn more exercises about spondylolisthesis and how to help build a self-rehab program for yourself, check out our channel, subscribe to it, or check out our fast track program for spondylolisthesis pain available at painfreeandfit.com. It helps walk you through all the steps you need to analyze your body, your posture, your mechanics, and your muscle imbalances, and build a tailored self-rehab program. Questions or comments, remember, write in. I'll do my best to answer. I hope this video on targeting planks with abdominal tension helps you with your chronic spondylolisthesis low back pain.